recording of Inspiring Stories Women Living with Diabetes in Pregnancy webinar. This webinar is another one of our patient-led festive series. This webinar is led by Dr. Tara Lee, who is an SD5 in Obs and Gynae and a clinical fellow at Norfolk and Norwich NHS Foundation Trust. Hear inspiring stories from women who advocate for themselves and empower other women. For further free content, please visit www.sbk-healthcare.co.uk. Thank you, and I hope that you find this webinar educational and enjoyable. I'm now pleased to introduce you to our webinar leader, Dr. Tara Lee, who is a clinical research fellow from Norfolk and Norwich NHS Foundation Trust.
Hi everyone, good morning. Actually, my role has changed. So I'm an SD5 Obs and Gynae registrar and also clinical research fellow, but I'm mainly working at Peterborough, so North West Anglia NHS Foundation Trust, but I am still doing my research at the UEA, which I am in now. So welcome everyone. So I was looking at what some people have said they were interested in, hopefully trying to get out of the session today. We've got an hour and a half, and we've got four really, really lovely women who I've had the privilege of getting to know and/or caring for during their pregnancies. So I think we should just get started if that's okay. So I was going to introduce you to all four of the women, and then two of them were diagnosed with having type 1 diabetes in their pregnancy, and two women were managed with type 2 diabetes during their pregnancy. So we thought we would separate them out into the two different types of diabetes just so we won't get mixed up, and just have a listen to their stories and their experiences of having NHS or NHS plus research care during their pregnancies. So if I could ask all of our women to put on their cameras and join us and introduce themselves, that would be lovely. Oh, you guys all look much more glam than I do, so welcome. So we'll go first. So Emma, do you want to introduce yourself first?
Yeah, hi everyone. So my name is Emma and I was diagnosed in 2012 with type 1 diabetes and I was 23 years old. It was after a virus. And then, yeah, I think I'll say just that for now.
Danielle, do you want to go next?
Yeah, sure. So I'm Danielle. I have type 1 diabetes. I was diagnosed at a very young age of 1. At the start of my pregnancy, I was undergoing multiple daily injections and finger prick testing. But I transitioned to an insulin pump and CGM monitoring during pregnancy. So that's me.
Seema, do you want to go next?
Hi everyone, I'm Seema. I've had two pregnancies, one with gestational diabetes and the second one, which was about 5 years ago. And by that point, I'd been diagnosed with type 2.
And Sammy?
Hello everyone, I'm Sammy or Samantha, either or. I was diagnosed when I was about 7 to 8 weeks pregnant, and I was diagnosed with type 2 diabetes.
Perfect. So I guess if we start with Emma and Danielle first, we'll start with type 1 diabetes. So what we'll do is we'll talk a little bit about your experiences of just having diabetes when you were first diagnosed and just before you got pregnant, and how you found out you were pregnant, if that was okay, and what that kind of meant for you. And then we'll talk through about during pregnancy, how did that change and how your experiences, because I know, Emma, you've had a couple of babies with having had type 1 diabetes, so you can kind of talk a little about that, if that's okay. So if we start with, when you found out you were pregnant, how did you feel about your diabetes care and how you felt about having diabetes and the impact that you thought it might have on your pregnancies? So whoever goes first.
Well, I guess I'll start, Danielle, and maybe you can fill in the gaps, because something that pregnancy do to you is that you can't remember much about what goes on. So I'm going to try to do my best. But I think the care I received to be pregnant in the first place, I think it's important to say that it took me years to have my levels in range so I could conceive. And I think that was a great support and great success to just be pregnant. And then during the pregnancy, I think what I realized quickly is how intense the care is and how the changes happen so fast and how the adjustments needs to happen on a weekly basis or even daily, and then or every 2 weeks. But I really felt like as soon as I was pregnant, it was like red carpet. It was like such a such a rallying of support and yeah, so going to the hospital every 2 weeks or having regular checks and also being able to be in touch with the nurses and having all the contacts over email or WhatsApp, all of that. That was absolutely quite night and day from the before being pregnant and after. Um, so yeah, so that's been my experience, and yeah, really feeling very lucky to have all of that support through the pregnancy because it's super complex, and I guess it depends on each person. So having that expertise from the doctors and the nurses for diabetes for women with diabetes, I think it was just so crucial and so important, and I don't think I would have had really good results without that.
And how about you, Danielle? When you first found out you were pregnant, what were your first thoughts kind of going through your mind, and what were your worries and like kind of things that you were most anxious about, I guess?
Definitely. So, before I was pregnant, I found diabetes difficult and relentless. I felt it was almost impossible to achieve the guideline targets that you're supposed to achieve. When I found out I was pregnant, how did I feel? First of all, I was one of the few that was very lucky to have diabetes specialist led a pre-pregnancy planning clinic, a clinic that I actually attended for 6 years before I was able to start to try to conceive. So when I did find out I was pregnant, after I began trying to conceive, I felt over the moon because it had been such a long, long journey for me. I felt unsure during that time because I wasn't actually sure because it had been such a long time. I wasn't actually sure whether or not I could have a baby.
Mm-hmm.
Um, I was terrified of my blood glucose going above or below these guideline targets from day one. I remember eating sort of a lower carb diet to help accommodate for this, and yeah, it was a really really scary time for me at the beginning.
And I guess I did say I would concentrate on Emma and Danielle for to begin with, but actually, if we're talking about from the transition of before pregnancy or kind of planning or trying to conceive, Seema, do you mind popping your camera back on and saying what your kind of thoughts were with type 2 diabetes? Because I think a lot of us, focus a lot in the hospital setting with type 1 diabetes. A lot of you are part of our specialist clinics and pre-pregnancy planning clinics. I feel like this isn't quite the same for women with type 2 diabetes, and this is one of the things that I really wanted to highlight for today. But what were your experiences? Because obviously you had gestational diabetes in the first pregnancy, and what was that kind of gap like between your gestational and type 2 pregnancies?
Essentially, so what happened after the gestational diabetes, I had my baby, and then there was no kind of follow-up, if you like, from any clinician. And I think 6 months down the track, I was asked to have an HbA1c. And, you're in that crazy time of having a baby and not really knowing what you're doing. So the last thing on my mind was blood sugars or any of that. So anyway, had my HbA1c, and by that point, I had started thinking about what I was going to potentially do in terms of a next baby. So I found out I had type 2, and even though I knew that my risk was much higher, it runs in my maternal family, and obviously I'd had GD, it was still a great shock. It was like, oh, no, it's caught up with me type of thing. But I think one of the things that bothered me now when I look back in hindsight was the fact that no clinician, no one had reached out to me to say, look, we might be able to help you a little bit here. You've had GD. Type 2 is looming if we don't do something. So that kind of didn't happen. Once I was diagnosed with type 2, I also went to a I can't remember the exact term, but pre-pregnancy clinic. And that was actually brilliant. It was with Professor Eleanor Scott, who is fantastic. And she really sort of helped me and everything. Because I was so frightened of what I just found out, as it were. So I found out I had type 2, and I know type 2, everyone has it in my maternal family. However, I genuinely didn't think it was going to happen to me, but it did. So I towed the line, as it were, and I did everything I needed to do to keep my blood sugars in check. And then, within the space of I think a year or so after being diagnosed, I did fall pregnant again. I've had IVF babies both times. So, blood sugars become the most important aspect of your life when you're going through this. And it is really frightening and really scary. But I had really good support with Professor Scott. She was amazing. So that's it in a nutshell.
No, that's really great. So then, I guess now we're talking about early pregnancy and becoming pregnancy. And Emma and Danny, you both talked about how you were kind of obsessively kind of looking at your levels and reaching targets. And kind of to put it into perspective, I mean, I know we looked after both of you during as part of the ADAP studies in various arms. Emma, how did you feel that was in having been part of this kind of big randomized control trial study on type 1 diabetes and pregnancy and on the management of it compared to, say, your first pregnancy?
Well, it's hard. When I was reflecting, my first pregnancy was during COVID.
Yeah.
And I didn't have a toddler to look after. So it was, in a way, I had a little bit more time. I was not running around going to work. I'm a freelance artist. And it was COVID for me was actually quite a nice environment to be pregnant because, we could go for a walk for half an hour, but that was it. So I had a lot of time to look after that side of it, which takes forever. It's like 24/7. And then when I had my second, it wasn't COVID anymore, and I had a 11 months baby, so it was very different. And but knowing, I mean, I was in a control group, so sadly I didn't get the closed loop. Um, but nonetheless, I received it. What was really great, it was to have more voices in the room when I had my meetings, and having professional be like, "Oh, we tried this," or "What goes on when this happens?" And then the care that happened throughout in between the meetings, that was really good. And I had an experience with an obstetrician that because the first meeting I wanted to have my tube ties because I knew I didn't want to have any more children. And he said something, "Oh, but it's a shame you're depriving yourself from having more children." And I cannot thank enough the diabetes team, who were all women, who said, "No, no, but you do whatever you want." And I was like, I wish that wasn't said to me, but I was like, okay, fine. But also, I'm kind of losing track of the question. But yeah, but the second time the pregnancy was, yeah, a little bit harder. And now I know that I was starting having symptoms of postnatal depression as well during the pregnancy. And so that was only diagnosed 6 months after the baby was born. But then I realized that that was also creeping in. So definitely the mental health aspect of pregnancy. And also it's quite known that when women or when someone has a chronic condition, mental health issues are more prominent. And I think the second pregnancy for me was probably in my sugar levels from a diabetic standpoint. Maybe it was similar or roughly similar. Both my babies were very, very heavy. So I'm quite strong, but like that was quite a test back to back. And plus the macrosomia, I think, and all of that really didn't help. But it was, yeah, it was fairly similar, I would say, looking at it from a very sugar level point of view. But physiologically, I think it was very different. Very, very different.
Just to jump in as well, to put it into context for everyone listening, Emma and Danielle did fantastically during their pregnancy. So they were very, very optimally managed and they had optimal glycemia throughout. So it was nothing to do with the baby, with your glycemia that you grew very big babies, Emma. I think that was a genetic thing that we've now acknowledged. But yeah, Danielle, how did you find, because I know, Emma, you were using Omnipod, wasn't it, during the pregnancies? Just standalone Omnipod and CGM. Danielle, you were lucky enough to go into the intervention arm, so you were one of the first few women on the CAM APS hybrid closed loop. How did you find that? Because I know you were DIYing before, so that's like a nice comparison as well to talk about.
Absolutely. So, similarly to Emma, my pregnancy happened during COVID, and I actually don't think I could have managed getting pregnant or that level of control had COVID not have been around. I was using COVID and the free time to develop their DIY pump. I developed a DIY artificial pancreas using the Android APS system. I had so much more time to be able to invest in that. And it was that that allowed me to get my HbA1c down to a safe level to begin trying. I think it was sort of week 10 of pregnancy where I was asked to whether or not I'd like to participate in the trial, and I was lucky enough to go through the closed loop trial, which was fantastic. As I said beforehand, my diabetes management was relentless. There was no way I was going to achieve it, but it just made the whole thing so much easier. I sit back and I reflect on sort of the time growing up. So because I've had diabetes for such a long time, growing up, I was led to believe that there were very few women who had type 1 diabetes and successfully had their babies. And I remember meeting other type 1 mums out and about, asking them for their contact details because I thought it was so rare. And I was put into this community with other type 1 diabetics going through the same experience, meeting so many other people. And it was really life-changing. I really appreciated that support.
So if I can invite Sammy to join us as well, I thought let's go through it in a chronological order as opposed to switching around. But Sammy, like you've obviously heard a little bit from Emma and Danielle about having pregnancy with type 1 diabetes. And obviously in your case, it was very different. We diagnosed you with probably type 2 diabetes right at the beginning of pregnancy from your booking HbA1c. How did you feel when you were told about it? Obviously you met us straight away, so we were very nice about it. But how did you feel about it?
Honestly, I was very scared. When I first found out about the diabetes diagnosis, I was worried about what effect it was going to have on my baby. And like some of the other women, I have diabetes in my family, so I know the effects it can have, type 2 especially. And I was worried I was going to have this massive baby. And yeah, it just, everything goes through your head, everything that can go wrong. But I had a fantastic team who I could ask any question to. It wasn't too silly or anything, and they really put me at ease on what was going to happen. And I actually ended up having a very average sized baby, so it was good.
And I think, and Sima, I think we talked a little bit about this kind of off screen, and generally we've chatted about this quite a lot. What are kind of the things that run through your mind when you were thinking, oh goodness, I've got type 2 diabetes in pregnancy? What are the kind of things that you hear from like society, from like your cultural kind of groups and stuff like that? Like we'll talk about this with Emma and Danielle as well, but there's so much out there, isn't there? There are all these like little sound bites and things that people talk about when like, oh, we've got diabetes in pregnancy. Like what are the kind of things that you hear and you still hear now about like these urban myths and things to scare people when they get diagnosed with diabetes and then they get pregnant?
Well, there are a multitude of urban myths. I mean, the thing for me was that I felt that I needed to research myself, and I felt that I needed to understand how am I going to do this. And I didn't actually go to any of my family. In terms of my generation, I didn't even know that my cousins, for example, may have had GD or were type 2. I didn't know. That time I actually didn't go to any family. I just kept watching things and reading things, and I found so much conflicting information out there that literally what happened was I got to a point where I think it was my midwife, my diabetes midwife, and I literally just sat down with her and said, look, I am really confused. Everyone is saying different things to me. I'm also freaking out because from my head, it was, I just felt guilt. I felt like if I don't do this right, my baby is going to, it's going to be affected. And I was confused. I'm a journalist by trade, so I had this thing, I need to understand this. I need to know what to do. But what I was actually doing was confusing myself. So I didn't go down the family route or the cultural route purely because I'm aware of all of the crazy stories that exist in terms of what you should and shouldn't do. But I went down another rabbit hole, which was equally confusing. And it was actually my midwife and Professor Scott who sort of geared me on the straight and narrow. But the reality of it is, once you are diagnosed with type 2, whether it's before your pregnancy or during your pregnancy, everything changes. Your pregnancy in itself is confusing. You lose agency over your body to some extent, but once you couple that with diabetes, it's a different ballgame altogether. I can honestly say that my pregnancies, both of them, what do I remember most about them? I remember finger pricking, and I remember being worried about my glucose levels. So it is really confusing. I mean, like, I definitely would say go to your clinicians and go to your midwives to get the information you need. Don't do what I did, which I'm sure everybody does do, which is literally hook onto anything that had diabetes type 2 and pregnancy related to it, because it was all incredibly confusing and didn't make sense. And in reality, what they told me did make sense. Nevertheless, it's a really tough journey to be down.
And I guess to just directly compare, Sammy, when you were first diagnosed and you said you had several family members with type 2 diabetes, did you talk to them at all, or did you kind of seek out information being like, oh goodness, you said you were worried about the impact it would have on your pregnancy, but what specific things were you worried about or had scared you?
Well, as I said, having a big baby was one of the main things. I didn't speak to my family about it really, but I knew a lot about diabetes and the effects it had on pregnancy before I fell pregnant myself. Obviously, I was unaware I had diabetes myself. But I did do a lot of research, which goes against what Selma was saying. But again, I get it. It was very confusing, and I did speak to you guys a lot about it, and you did reassure me that everything was going to be okay, and But yeah, I should have spoke to my family more, but it's one of them things.
I think everything is different though, and everyone is different, and everyone's families and social setups are different. Emma, Danielle, what kind of things did you kind of were worried about or feared during your pregnancies when you were thinking, oh, I've got type 1 diabetes in pregnancy? What are the things you were told or misconceptions that you were given? I know Danielle had already mentioned you weren't sure if you could even have a successful pregnancy, which feels crazy in like the 21st century, right?
Yeah, definitely. I think following on from what Seema said, and everyone else, sort of the big baby myth was a big thing in my drugged sort of emotional state. The first question after her being born, my question was, how big is she? That was what meant the most to me. I don't know why. And it was almost like it was a measure of how well I'd controlled my diabetes throughout, which is a shame because it's like you said, it's not always directly related. I also received a lot of conflicting advice throughout, things about diet. I remember being told that a low carb diet would harm the baby, and that I shouldn't be eating a lower carb diet. The diabetes specialist team were really reassuring and supportive throughout. It was more the non-diabetes specialists that sometimes exacerbated those fears, not deliberately, I'm sure, but by commenting sort of outside of their area of expertise. I found myself kind of wishing that they would have withheld their either opinions or comments, and be really clear that that's not the area, that they're the expert, and point us in the direction of who can support, because it is that cross functional care. We're working with diabetes specialists and midwives who might not necessarily have the experience that each other have. So that was a really key thing for me. The other thing I found, the really difficult time I had, was that sometimes staff would review isolated data points. So they might look at my carb intake without actually looking at my blood glucose readings. I remember being told to change what I was doing, and they hadn't actually looked at what my control was like. And I was within the lines, like you said, managing things perfectly fine. I knew my body. So it was quite frustrating to hear advice being given on that one isolated point. But luckily, I'm the type of person that doesn't take anyone's word as gospel. I go away and like Seema, I'll research and check that the information. So I was able to sort of challenge when I felt that I was being given something that wasn't the best advice. But I do worry that there are other people around that might not feel as confident to challenge those comments or thoughts.
Mm.
Yeah, Emma, what do you
Yeah, I
think?
want to echo the isolation. Like Danielle, I'm so happy like you found your tribe of other women with type 1. But I remember asking to be put in touch with women with the same. And I think there's a huge issue with like sharing contacts, but definitely that's a huge need that I didn't have. I knew just someone in London that I could call, but it was quite different. And I think for me it was like this isolated, like I don't really know anyone with type 1 around me. It's not in my family. I'm the only one in the family that got diagnosed with this. And most of my family don't really understand. They just know it's about sugar levels, but they're like, because I got diagnosed when I was an adult. They never had to look after me as a child. And so yeah, doing loads of research, I remember finding a book that was literally life-saving. I was like just following the book. I was like, I'm not going to think too much. I'm just going to follow the book week by week. And it was by someone called Ginger Vieira, and I really loved that book. And I remember bringing it to the clinic and be like, I'm following this. Is it all right? And they were like, yeah, fine. And they were like, as long as you're like looking after yourself, most people are very happy. But yeah, I think that was really helpful and I loved it. I loved having like a blueprint, like a template of like, this is what's happening this week and this is what you need to do. And that really supported me. But the isolation of like, am I doing the right thing? Are we going in the right direction? And sometimes I could feel like, oh yeah, if your levels are all right, people seem to say, oh, everything is fine. But then what happened to me was when I had my first baby. So it was, I wanted to try to have a vaginal birth, but I didn't know the stat that 70% of women with type 1 end up having C-sections. So that wasn't given to me. It was like, oh, we'll do whatever you want. And I think with women with such condition, I don't think it's fair to put all of that on us because we don't have all the data points or all the knowledge that goes around like what it means to deliver a baby with type 1 diabetes. And then in retrospect, when I found out it was 70%, I was like, oh, okay, that makes sense. I was induced. And then the baby was not going to come out anyway. But, and yeah, it was £11.9, which I'm so glad it didn't go out. But it was afterwards. So I was fainting a lot. I lost a lot of blood because of the induction, probably loads of chemicals in my body. And I remember a midwife being like, I can't deal with her. Like she's basically said that because I had type 1 diabetes. She was like, it's too much for me to comprehend. And type 1 diabetes had nothing to do, literally nothing to do with what I was experiencing. But I remember her freaking out because she suddenly had to look after me and she didn't really have the knowledge. So I think it's also like the cross care that we have. And when we have a nurse that knows about diabetes, like it makes such a big difference, like a huge, huge difference. Even if it's just someone like, yeah, her levels are fine. She's fine. She's got CGM. It's all good. This is a different issue that another woman with that type 1 diabetes would have had, and that you as a midwife is totally capable of supporting and dealing with. So yeah, it just freaks people out, type 1 diabetes. And so I'm always the one that has to say, no, I'm controlled. I'll deal with it. My husband as well, I wanted to mention, my husband being like so helpful. Like he learned so much. He knew exactly, he nagged me every hour to be like, did you test? Did you do this? Why is this beeping? Like, how much carb is that? And I think this was like, I was doing it for me, for the baby, but also was doing it with him. And I think that was like so helpful. And I think partners and husband, like they should come to like Daphne training and all of that, because that is something they have to do, but they have to do without us taking them to all the meetings and stuff. So yeah, so that's been my experience. So, but I think everyone's got different experience.
Yeah. Seema, you put your hand up. What were you going to kind of fill in with?
I was just going to say, I mean, type 2 still has a lot of taboo around it. And I think that for me, that was an issue. Despite the fact that, as I say, one side of my family, everyone has it, I was embarrassed to tell people that I had it. And that's probably when I look back, that's one of the key reasons why I didn't go to family. I felt it was my fault that I had it, despite the fact that I'm genetically inclined towards it, unfortunately. But just to reiterate what Emma said as well, my husband was my greatest support network. He was the network. he was the one who helped me get through both pregnancies and all of the pain of finger pricking, which is, as I say, the key thing that I remember. But yeah, diabetes is not fully understood generally. And it is really tough when you yourself are feeling that guilt of, oh my God, did I bring this upon myself? It's quite tough to then go out there and actually start asking people for help.
Yeah. Sammy, I was going to ask, in line with type 2, because I think, there's a lot of focus on type 1, in terms of new technologies, and it's a very visible thing. And a lot of people find it a good thing in type 1 diabetes because, then, as Danny has said, you can find your tribe, you can recognize other people wearing CGM or wearing pumps and things. With type 2 diabetes, I know you work kind of allied with us in the healthcare service, so I'm kind of leveraging your knowledge from this point of view. But did you also feel with type 2 diabetes it was not the same, like it's not considered the same as type 1, it's a very different kind of diabetes, there's a lot of stigma, or people don't really want to address it head on because they think, oh, is it going to say something about you as a person? Have you encountered that either personally or through your line of work or family
Um,
wise?
yes, I have. There is a lot of type 1. There is a lot of stigma with it. Yeah, it's sorry, I'm a bit
It's
caught off
okay.
guard there. Um, I have had people, because I had one of the monitors in, because I was doing this study with you. I had people ask me what that was, and when I said, oh, it's because of my diabetes, keeping control, like keeping an eye on my sugars, they were just like, oh, and very like, didn't want to follow up. But educating people is the best thing. Um,
Just talking
sorry.
about it, isn't it? I
Yes,
think,
yeah,
you
absolutely.
know, I think having all four of you on, type 1, type 2 diabetes, I know it's very different. I see from a healthcare professional side that a lot of my general maternity colleagues are quite scared. They will openly say they're quite scared of patients with diabetes. How did you guys get around it? I know Emma and Danny, you've already talked a little bit about when you came in to deliver your babies. You're obviously there with 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 your technologies, or maybe without technology, but finger pricking and all of your medications prescribed. How did you feel when you kind of met the midwives coming in labor or coming in for your cesarean sections? How did that feel during labor and that kind of time of time of your pregnancy, I guess?
Who was that aimed at?
I think
Oh,
it's
sorry, I
for
wasn't
me and
aware.
Danielle.
Yeah.
I'll start. So, um, I think because I was visited a few times by the diabetes specialist nurse, especially for my first baby, it was quite seamless. But I had to always keep reassuring the midwives, be like, "Don't worry, they came, they looked after me, I know what to do." I, changed my basals to like 50%, even though it feels super weird to like, I was a little bit scared of like, I'm not gonna have insulin coming in the body, but it's like all of that. But then the second time I was so like, I think I had like, I was so, so lucky because Tara, you delivered my baby, and you were also my diabetes midwife, and I could WhatsApp you like 6 months after, like even I can still do it even though I don't abuse it. But like, it's like it was so special because you were like, oh, I'm gonna try to be the assistant of the surgeon, and then the surgeon had to leave, so you had to literally open and do the C-section yourself, which I don't think this happened often. And that felt like I was just so, it was just the best care. Like it felt like you were like you were there at the beginning, like 4 weeks. Since 4 weeks I was pregnant until like down the line when the baby was 6 months old, and it's just like it feels like even better than having a doula, it's like even better than having your mom around. It's just like the person who knows you so well, knows everything, all the history of what you've been through, and just helping through that. But then after the pregnancy, yeah, I think it's, as a person with the illness, is like we have to reassure everyone around, being like, it's okay, I've got this, it's fine. Like I'll deal with it. I know how to deal with a hypo and like so it's weird because it's at the time where you need a lot of support, but then you're actually supporting some of the staff and the doctors, and you're like, this is a bit. But I received one advice when I got diagnosed, and that was like 10 years before I got pregnant, and it was like, you are your own doctor. And for me, one thing that always step in every GP practice, every hospital, is like, I am as a doctor as you are, because I know myself a lot more than you. So it's like, let's work together. Like, you know things I don't, I know things you don't, and we're going to work together. And I think that that mindset maybe makes things a little bit easier for me, because then I can ask for what I need. I just say what's going on, and people feel like I'm confident within what I know, and then I can ask the things that I don't really know about. The second time we went to NICU, which was a little bit traumatic, but in the end, that was a thing that I didn't know, that insulin. I don't know if you had that, Michelle, but like Danielle, but the baby's lungs were not as developed as they should be. And so how the insulin I was injecting through the pregnancy actually slows down organ development. And that I had I had a baby. Like I feel like I should have known that, but I was never, never told or never read about this. And then we ended up going to NICU. Things got kind of better, but we spend a lot of time at hospital. And it's like, I think there's also that aspect of both time. I ended up having a week or more than a week at hospital after the C-section for different reasons. They're not all diabetes related, but I I look at it and be like, yeah, it's not a great environment to spend time with a baby, but at the same time, it was kind of good to also be there and have the expertise. And I had some midwives who detected tongue ties and all these other things. And I think, yeah, that support was great. But yeah, it's always a bit of like, yeah, tension with people when they hear type 1. It's like, oh, she's the one down the corner, and you get flagged. It's like as if you get a little stamp on the curtain. Like it's like, oh, yeah, leave it to the doctors, leave it to the specialists. And it's like, well, I don't know. It's not that scary.
What about you, Danielle, in terms of coming in for your delivery and things like that, encountering other members of maternity?
Yeah, definitely. So for me, delivery expectations were a constant source of my anxiety. I'm sure that's the same across anyone who's pregnant. But I remember reading about the first natural type 1 diabetic birth when I was pregnant. I think they might have actually been on the trial earlier in the trial. And it was only then that I learned that type 1 diabetics often aren't recommended to reach full term. So I started looking around me at other mums or other people who are pregnant and had babies, and I noticed that none of them had babies before 40 weeks. That was the trend that I saw with my close kind of the people around me, let alone 37 weeks, unless there was a problem. So what I was reading, I was understanding that natural birth was impossible, pretty much, or nearly impossible. And the thought of being induced really filled me with dread. I was really anxious about that. I expressed these kind of concerns, these fears repeatedly to everyone that I saw in those early stages. And no one sort of explained to me that there were other options. For example, like actually going in for an elective C-section, there was only one single consultant that said that was a possibility to me, and they actually framed it with quite severe emotional pressure or even emotional blackmail, let's say, and made me feel really guilty for even wanting or considering that, which was really difficult. So I, knowing all of that, I kept asking for when I will likely be induced, what date I would be induced. And I was constantly told, oh, we'll discuss that next time. We'll discuss it next time. It was put onto the back burner. So this kind of added to my anxiety and feeling of uncertainty. I was having the naturalness of my birth taken away from me, but then also not being able to set a date for when the unnaturalness was going to happen. I don't know if this is a practice for other pregnant women or people have to be induced early, but I've really felt conflicted about that fact, the fact that it would be planned, but I couldn't plan it. On top of that, I didn't feel comfortable with the induction at all in the first place. I was also particularly uncomfortable with the fact that once diabetics are induced, they can't go home. They have to stay in hospital. So that was another thing that was frightening me. And not to forget that this was all during COVID. So not only was all of this happening, I was on my own the whole time. I know others have mentioned their husband's support. For the majority of the time that I was in hospital, I didn't have that luxury, which was a challenge. So delivery itself was an area where I felt sort of unable to lead my own care because of the emotional stress behind it. I was kind of hoping that someone could take the reins from me whilst respecting my autonomy to understand what my options were and to make decisions when I could. Thinking about the birth plan, for example, I felt kind of railroaded into this: you're being induced, there is no other option, and that I couldn't push for what I wanted. Next time around, I'm going to be a lot firmer with what I want out of the situation, if I ever get a next time, that is. Delivery staff weren't particularly confident in diabetes management, and like we've kind of talked about, the clinical trial that I was on, they definitely didn't have confidence in that, and it made me lose a little bit of trust in their ability to manage any diabetes issues that might crop up. The trial team were really brilliant, and they put together like a document pack to explain to the staff what was happening, what technology we had. But I didn't witness a single person read it or understand what was in there, which was a real shame, because there was a lot of work that went into that, and it would have been really supportive to me in that moment. So throughout delivery, I was very much in the driving seat when actually I wanted support. I wanted as much support as I could get. And I ended up relying on the trial team, talking to the delivery staff, in order to kind of make that happen. Now, the issue we had there was that because I was induced midweek and the induction started to fail by the weekend, the trial team and the delivery staff, they both weren't available at the same time. So important conversations happened between the teams over the phone because no one was sort of no specialists were on site to support. And that meant that I wasn't involved in those conversations. And there were times when my ability to make decisions was kind of disregarded or overlooked. A particular example where I really put my foot down in the delivery suite was when a consultant was really pushing sliding scales on me, and I was trying to explain to him, look, the tools that I have, this clinical trial that I'm on, is way more effective than sliding scales. I don't need to be put on a sliding scale. And I was having this argument and we were getting nowhere. And it wasn't until, thankfully, the trial team were able to speak to the delivery staff on the phone that they could kind of put a stop to that. And so that was really, I'm really grateful for those conversations that were had. But I'd really encourage people to sign up and learn more about anything that their patients are sort of using to manage their diabetes. One last sort of thing that I faced that I found quite challenging was I had quite a lot of hypos during delivery. One of which happened after there was a decision made to that I was going to have a C-section. So obviously at this point I'd been told not to eat anything. And I wasn't prepared for this or how to manage it because I didn't know what to do in that moment. Help, because of COVID, I was in an isolated area, and help took quite a long time to arrive, and it involved kind of sourcing some apple juice, I think, at the time to bring my blood sugar levels up. This was a sort of quite a worrying time that I think could have been prevented with a bit of prior education, and a little bit more help in terms of hypo management plans in those very niche examples of situations that can happen. And immediate access to suitable treatment, whether that's we bring it in and we're prepared as patients to be able to deal with that, or it's available in the delivery suite. Sorry, that was a long one for me, where I feel most passionate.
Well, I think, this is something that hasn't gone away. People have had type 1 diabetes for a long time. We know that hypos are very dangerous and very sudden, especially around the times, you know, in third trimester and around delivery, you're at real high risk of hypos. And, you know, we used to be a general medicine doctor before I started training in obstetrics. Everyone is prepped to manage hypos. Nurses know that it's a medical emergency, and so do most medical doctors. I feel like that emphasis isn't quite the same. I don't know if it's because we don't see as many people with diabetes. I feel like that's not true because you guys are everywhere. But, you know, I think hypo management and management of an emergency severe hypo where you need third-party help is something that is sometimes overlooked in maternity care settings. We've had a similar situation recently. So, yeah, thank you for bringing that up. Seema and Sammy, how about your kind of thoughts and kind of, I guess, plans around in the run up to delivery in terms of how you'd like to deliver, timing of delivery, and then also kind of, yeah, that interaction again with maternity staff. How were your experiences of that?
For me, I decided quite early on in my first pregnancy that I was going to have an elective C-section. I was told I was high risk from the first time I met a midwife due to the fact that it was IVF and I was a geriatric mum, which is such a fantastic term. And I didn't know what I was doing. I wasn't sure how this was going to go. And I was frightened of the concept of a natural birth. So I thought the sensible thing to do would be to have an elective C-section. Everything was fine up until probably my third trimester, and it was probably maybe a month or just over a month to go. So about 6 weeks left, and I met with a registrar, a routine appointment. And this particular registrar, who I'd never met, and that's another thing, you meet obviously different doctors all the time. And then you have to sort of explain the whole process to them in terms of who you are, what you've been through, what your blood sugars are. So this particular registrar wasn't happy about my elective C-section choice. So she took it upon herself to basically speak to my husband and I and say that, why are you doing this? And I was quite taken aback because I'm fully versed in terms of what I understand, and I have the ability to ask questions. So up until that point, I've been speaking to consultants, asking the right questions. I understood, and I felt that this was the correct thing for me to do. My husband was in agreement. She was not happy, and she basically said, you should consider a natural birth. And it was a really odd situation. It was like the last appointment of the day, and we'd been at hospital for like a couple of hours or so, just waiting to see somebody. And it was like a cat amongst the pigeons, her saying this. And then essentially, I had to then speak with a consultant the day after. And I was actually really upset because up until that point, we all were on the same page. Suddenly we were not. Her reasoning was, well, I don't think you've considered the natural birth option. And my reasoning was that everyone keeps telling me I'm high risk. I can't risk anything happening to me or my baby. So we did obviously have an elective C-section, and the second time round we did the same thing. My issue in terms of delivery staff, and perhaps issue isn't the right word, but my problem, which means the same as issue, is the fact that I was the one who spoke to them about being type 2. No one really spoke to me. Nobody really wanted to understand where I was. They sort of have one quick glance at the notes, all the various people that I met, and it was me who was explaining to them. So Emma's words about how you kind of become your own doctor, that's literally what I was. But I was a bit more emboldened the second time around because I felt that, I have agency here. I've been through this once before. I know where I'm at. I understand what I need to do. I've been doing it. As it happened, I had an awful labor. I did have a C-section. Things went pear-shaped, and I ended up in hospital for a week after. But once again, my diabetes was never, ever really spoken about. I remember being in recovery for that week and actually asking the midwives, look, are my blood sugars in the right level? I don't know, because I was recovering. I've gone through something awful, but no one really spoke to me about it. I spoke to them. And it was after pregnancy, after the labor, and I came home, etc. And I was still seeing my midwife. It was then that I thought to myself, hold on a second, no one's spoken to me about what happens next. So I was concerned about the fact that, well, up until like all of this, no one's really spoken to me about my blood sugars. And now I've had the baby, I've gone through all the complications, etc. What next? And it was like, well, you need to speak to your GP and da, 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 da. But I think it's just conversation. Somebody just needs to speak to you and explain to you that you're right, okay, your blood sugars are okay, or your blood sugars are not okay, and we're going to be doing this and we're going to be doing that. And then you need to see your GP, etc., etc., etc. None of that happened. And as I say, I definitely was the one who was telling the staff where I was at. And I remember at the time, and I certainly in retrospect think, if I didn't know how to speak English, if I was a South Asian woman who didn't know how to speak English, I don't know what would have happened to me. Because no one really was up to speed. No one perhaps had the time to be up to speed in terms of what was going on. Even though my labor went a bit pear-shaped, obviously I had a really good anaesthetist who was checking my blood sugars, I remember at the time. But overall, if I had not been able to tell people what my history is, my health history, I would have potentially been in a different situation. And that is so wrong. And that's so scary. And I've never forgotten that, and I've always thought to myself that, gosh, had I not been able to understand my own health history, where would I have been? And I remember I was on the day of delivery, I was repeatedly asked by various clinicians and midwives, are you a clinician? And I remember saying to them that just because I know what my blood sugars have been, can't I just be a normal person who's just aware of their health history? Do we have to be a clinician to be in that point? No, we don't. But yeah, if I wasn't able to articulate that, I think there would have been problems.
And how about you, Sammy? How did you find kind of working with the maternity staff and stuff during delivery? And I think you're just still on mute. Sorry.
Sorry, I forgot to unmute. As you know, I was induced, and the induction process, my body adapted to it very quickly, but because of the time of year, I wasn't able to go on to delivery until a lot later. I think I was ready to have him 4 days before I actually was on the delivery suite. But I found, as the other women, that I had to tell them about my diagnosis, and that no one really looked at paperwork and stuff. But as for like my planned delivery, it was just whatever was going to get the baby out the safest, which was a natural birth I ended up having, which was very quick once I got started. But I did find the staff, although the midwife I did have, she was absolutely brilliant, I was having to tell them about my condition. But once they did understand, they were very good. They did keep a very, very close eye on me and my blood sugars at the time, which was excellent, because I was completely out of it, to be honest. You're sort of in a completely different dimension when you're giving birth. But yeah, apart from repeating myself by what the other women have said, it's pretty much very similar.
I think that's what we hear a lot of, and it's really, I would say reassuring, but it's not really reassuring to hear that you guys are all saying the same things. Like, we know how stressful and sometimes traumatic delivery, or, labor, delivery, all that time surrounding it, how uncertain it is. We're telling you that you know your own body best and your own diabetes best, and we want to give you as much agency as possible. But we also are then putting that responsibility on you while you're going through that horrible, stressful time that every woman who has a baby goes through. You're also still having to manage that diabetes alongside it, and having to tell people about how to manage your diabetes and how much you want to offload. That's a lot of mental extra burden, which is really unfair, and I'm really sorry on behalf of everyone. But you guys are great, but that doesn't make it any less of a worry and burden. And I think, Seema, it's really important to highlight that, especially, you know, in the type 2 community where we have a very much more diverse population of women. A lot of the majority of women I look after in Peterborough with gestational and type 2 diabetes are more likely to not speak English. Um, and actually having that confidence to say, you know, we know a little bit of diabetes, we can help manage it for you because you may not have that health literacy or agency or feel confident because, you know, regardless of you, even if you do speak English, this might be your first pregnancy, you have no idea what is going on and you cannot advocate for yourself as much as you would like to or how much you would do normally or professionally, if that makes sense. So no, I think that's a really important thing to highlight. So I think just for the last kind of 5-10 minutes before we go and see if there's anything from the Q&A, or leave it open to you guys and see if there's anything you'd also like to talk about, I'd like to just talk about a couple of things. So firstly, your experiences immediately after delivery. Because, you know, from a diabetes medical point of view, we write these very detailed plans, which I'm really sad to hear that no one ever reads once you get onto labour suite, about managing your diabetes, and also about kind of what's life like as a mum with diabetes. So to go on to the first bit, I think, you know, with type 1 diabetes, we obviously slash your insulin levels right down straight after delivery. As soon as that placenta comes out, we halve all your doses. We try and remind you not to overdose yourself on insulin with the first tea and toast. How did you find that? I know it's very, you said, Emma, you said it was scary just thinking, oh my God, I'm getting no insulin now, having really increased your doses towards the third trimester. How did that feel? And how did you feel like it was a battle with the staff you're working with? And then once you got home, what were your kind of big worries in terms of your insulin management and your diabetes in general?
I think for me, it was more like, okay, for the past 4 years, trying to conceive, being pregnant, being super like, like literally have to be in such tight range. And then suddenly you have the baby, and I had to really switch and be like, if I'm 12.5, I'm 12.5. And this nothing's gonna happen. I had to like really not care as much because suddenly I was learning how to breastfeed, jaundice, having to heal my wound, like, can I walk? Like, all this stuff took priority. So I think for me, it was like, if I'm not high for more than, I don't know, an hour, like, we're fine, we're doing well. So I think it was like taking a bit of a backseat for the diabetes care. And I think the diabetes midwife who came, diabetes nurse who came, you know, she said that, and I was like, okay, I've got other things to focus on. But I think for me in the second pregnancy, because I had literally a toddler or 18 months old and a baby, the first, I would say, if I span it, the first a year and a half, 2 years, it was literally chaos. Like, I could not look after my diabetes because I can't, when you're looking after other babies, you can't really look after yourself. Like, if you have a shower, it's great. So diabetes, like, what was that? I completely forgot what I need to do. Um, so, and I wasn't on the closed loop yet. And then I remember going to the consultant and be like, I'm just struggling. And like every 6 months, I was going to see to have a meeting and really struggling, and them not being able to help me because it's just like 6 months is too long. Like, what do you tell someone? So being put on the closed loop for me was like life saving because it's that part of the brain I can just switch off. I mean, it's more important to save kids who are running out of a playground than looking after your sugar levels. Like, there are priorities that happen when you become a mom that it's very sad to say, but my HbA1c was like, I don't know, it was not great. And since I'm on closed loop, it's back to being really good. And also children growing up means I've got a little bit more time for myself and all of that. But definitely being the aftercare is so different than what we get during pregnancy or for conceiving. So it's, yeah, I think I had to do a lot of like trying to be kind to myself and be like, this is where I'm at. My priority is in them. My health is taking a little bit of a step back. Sometimes it was, I mean, having postnatal depression also heightened that because I was like, I'm not able to look after my health. I'm not able to look after my kids. Like, it was just not, it was just really, really difficult. But saying that, I think now in retrospect, now we've got the technology, and I wish I had my babies in a way like 3, 4 years later, because then I would have had the technology to conceive, to go through pregnancy, and then afterwards having the closed loop would have been so, so helpful. Especially also, I didn't mention breastfeeding, but breastfeeding having such an impact on blood glucose. So yeah, so all of that. And for me personally, having children and babies and with diabetes, is that I was completely drained, and then I breastfed, which I enjoy doing, but at some point the body is like, enough. Like literally my body could not take anything. Like I was just like, just this baby needs to feed themselves. Like this is not happening. But yeah, and the toll it takes on the body, like mentally and physically, is really, really strong. Like my baby was so heavy, I was cut open, couldn't carry them, couldn't really like look for them. So I needed a lot of help to bring the babies to me. Having a baby in a carrier, for me, that's like non-existent, because it's like they were literally too heavy for me to carry. But it's like it was, yeah, it was, I had to like forget a bit that I had diabetes for a while, because I just couldn't look after myself that way. Like I was like, as long as I'm sustaining, I'm not too hypo, or if I'm hypo, I take sugar. Like I was just not really worrying at all about that. I was like more worried about, I mean, just caring for someone else. You just don't have the brain space for it. I'm very sorry, but I'm gonna have to jump onto a work meeting now. And it's
Yes,
been
no
so
worries.
lovely to be part of this and meet
Thank you
you
so
all.
much, Emma.
Thank you.
Yeah, Danielle, how did you feel kind of, yeah, straight after delivery and then after, especially after that long labour with unsuccessful induction and then ending up with an emergency cesarean and having to change your settings on your pump and the closed loop?
So, like I said, it all happened towards the end of the week. So, I actually, unlike Emma and Seema, I was discharged quite quickly. My husband and I kind of felt a bit alone and unsupported with post-birth diabetes-related challenges. I've got a few examples of things we faced. So, our baby had a low blood sugar at birth, and we were aware that that could happen, but we weren't informed about what levels were dangerous and what weren't. And we were quite surprised to learn that neonatal blood sugars are actually a lot different to adults. So that was our first kind of challenge. We were then, or I wasn't given much guidance on C-section aftercare before being discharged. So sort of the safe ways to move around, wound care, how those general guidance differs with diabetes. I was just sort of told to get on with it and carry on. And like Emma said, breastfeeding support absolutely was a key thing for me. During planning and pregnancy, I was led to believe that breastfeeding, again, was almost impossible. In hindsight, I don't think that was the message. I think the message was breastfeeding is hard and diabetes is hard. So the two of them together are obviously hard. And at the time, it was quite intimidating to kind of hear that. So I think a lot more can be done to support women with diabetes that are planning to breastfeed. It was difficult to find. I went out and actively sought it out, and still ended up in hospital with jaundice despite me reaching out for that additional support. So I definitely think that's an area we can work on. As a mum with diabetes, hypos are my biggest concern. From the age of 2, I taught my daughter to understand what hypos are, and she actually sees them as shared moments now. We share sweets when I'm hypo, and she absolutely loves it when mummy's hypo for that reason. She knows how to call for help. She knows our address. We've practiced. We've had like scenarios where things happen. She's really curious and comfortable with my diabetes care, so cannula changes and devices, which is great. I haven't dipped her toes into numbers just yet. I think she's a little bit too young for now, but when it's age appropriate, I will. And I'd really love to be able to see some kind of education designed for parents for children with parents who have type 1 diabetes. And sorry.
Oh no,
Sorry.
no, you carry on.
The other thing that was a particular concern for me was passing diabetes on. So I actually completed the ELSA study quite early on, for my daughter as early as I could. And I would love to see that type of thing being available at birth, because up until I did was able to do that test, I was constantly worried that she may be impacted. And future pregnancies. Obviously, COVID slowed the world enough to allow me to have my last one, and I'm not sure I could do it again whilst parenting, as Emma said. But clearly, you can, because Emma's done it successfully. Well done. And working full time. So I hope one day I can do the same again in the future.
No, thank you for that. I think I'm yeah, a bit disappointed that Emma had to go, but obviously it's my time commitment. I'm not very good at timekeeping, as you can see. I could talk about this all day. But yes, because one of the things Emma's really interested in is about talking to, especially mums with type 1s, how you communicate and when do you communicate that with your children, because, you know, hypos, DKA, these things can all happen, set failures. And how did you start broaching it with your daughter, Danny? Like, you know, obviously she was quite young when you first started talking to her about hypos and your shared moments, which I think is super cute. But yeah, when you were talking about diabetes, like mummy has a condition, like how do you go through that? Like, what are your kind of start steps? Because I know it's hard.
Absolutely. So from very early on, she used to, as a baby, she used to tug at my tubes. And when she was old enough to ask me what they were, she would ask me, and I'd tell her. And just slowly from them, I'd drip feed a little bit more information. And as she got older, she would hear sort of my alarms go off when I'm going hypo. And again, she'd ask what they are. And she very quickly understood that the alarm meant sweets. She learned where the sweet drawer was. It's drip feeding as she's grown, and when she's expressed an interest, utilizing that opportunity to tell her what's going on.
Oh, that's great. And Seema and Sammy, obviously with type 2 diabetes, we tend to really cut everything out. Like a lot of our women, you know, having started on metformin or insulin during pregnancy and going up to quite, you know, sometimes quite large doses, it feels like, especially if you've not had anything before pregnancy or been on kind of tablet medication before pregnancy. How did it feel being like suddenly have to go on the labour ward and having to tell women, your staff, I've delivered now, I don't need anything. I've seen in the notes a couple of times, the woman assures me she does not need any diabetes medication because has type 2 or gestational diabetes. And it feels kind of a bit of a quite of aggressive documentation to sometimes read that. How did you guys feel from your point of view?
I think from my perspective, the first time around when it was gestational, it was really weird. It really was weird because they were like, eat this toast and now you can eat anything you want to eat. And it was like, oh, no, I can't. Second time round, everything was a bit blurry in the sense that obviously something else had happened and I'd ended up in hospital much longer than I'd anticipated. And the reality of it was that no one spoke to me about type 2. I was asking them. And I was sort of told not to worry about it too much because you've got other things to worry about right now. But overall, I'd say in terms of aftercare, for me, in terms of type 2, there really hasn't been any. You know, I can't. I had a midwife who came to see me a bit longer than normal because of what had happened. She used to sort of reassure me that, look, don't worry about it right now. You need to, you know, get better, etc., etc. But I did worry about it, and there was no follow-up. There was no follow-up from my GP or anyone. It was just that routine. 6 months down the track, I had to go for an HbA1c. I found it really difficult to think about my blood sugars, even though they were at the back of my head. You know, I had 2 kids to contend with, and it was COVID. So I just muddled through, and things were up and down in terms of my HbA1c. And I remember maybe it was about a year after my second daughter's birth, I actually called my diabetes nurse at my GP surgery and said, look, I need some help here. I'm freewheeling and I'm trying to do the right thing and I'm not doing the right thing at the same time. I've got so much on my plate, I don't know what to do. And she sort of suggested that I do the education, the training thing that they have, 3-day training, which I found really useful when I was first diagnosed. This time around, it was of no use to me whatsoever. My diabetes care has been led by me. And I, for example, have just a few months ago spoken to my doctor about what's it called? The Jardiance, the SL, whatever it is. I was the one who went to them and said, look, I've heard a lot about this. I want to be on it. So I think there are there are issues to be had here. And I think a pregnant woman with type 2, no one really talks about it. No one's really interested. That's what I felt. When I went for my delivery, no one was really interested, other than, right, what is your blood sugar right now? That was about it. And then once I had the baby and everything else, once again, I fell off the radar, as it were. And you're sort of back to your own devices, which is what it was for me.
Sammy, are you still with us? How did,
Yeah,
because
I'm
obviously your
sure.
little one is a bit younger than
Yeah.
these other ladies, but how have you felt in the kind of months after delivery? I feel like, well, we don't really see you because we're part of the maternity diabetes team,
No,
but
no. I agree with Seema that you're pretty much left alone. And since having my baby, I've had two HbA1cs. Is that the right one? My first one at 6 months, my levels were completely fine. And then I had one at a year, and my blood sugars were high again. So I've been put back on medication. But apart from that, I had to kind of be like, what's going on? Because after I given birth, I was taking off everything, as type 2 are. I don't think they quite believed me to begin with. Because they kept asking me if I had enough medication at home and blah, blah, blah. And I was like, I've been taking off everything. I'm not on anything. And yeah, you just abandoned in a way and left to deal with it on your own. I mean, I wasn't even checking my blood sugars. I'm still not, because of the medication I'm on at the moment. So I don't know how my blood sugars are at the minute, but this is what I've been advised, and yeah.
I think that that's a huge change, and the you know,
Yeah.
one of the biggest differences between type 1 and type 2. You know, type 2, the nice guidelines still say don't even finger prick, unless you're on insulin, or you have other worries about hypoglycemia. Whereas, you know, type 1 diabetes, you know, you're constantly monitoring your blood sugars whether you want to or not, and you know, a lot of the technology has made that easier. So I think that kind of brings towards the end of my structured questions, and we've got a few questions in the Q&A. I think we'll start with the last one, and then if you guys want to put, because there's some more didactic questions that are more factual, so if you guys wanted to answer by typing, that's absolutely fine, but while we're chatting about other things. But I guess the first thing to start, as I'll answer it live, is do you guys have any advice, or from your experience and your point of view, how would you kind of talk about having difficult conversations with clinicians when you feel your experience or your point of view is not being responded to? What's your advice? What would you say, apart from being more bolshy, because that's my always advice to you guys? Please be bolshy, tell me what to do, I don't mind.
I think something that Emma said before about us being the doctor, really framing that, so framing ourselves as the expert, because we're the expert on ourselves. For me, make sure you like, if you can, take support along with you. Sometimes your partner or someone else in the room might feel able to speak up if you don't. Like you say, with being bolshy, sometimes I'll ask a bit of a sarcastic comment like, "Oh, I didn't realize you were diabetic. How long have you been diabetic for?" That's sometimes my approach if all else fails. But the other thing I'd say is ask for their reasoning behind what they're doing, because perhaps if you can understand their reasoning, you might change your view. And then if you explain your reasoning for why you're saying what you're saying, again, they might change their view. So just feeling like you can be really open and honest, because if you don't, like me, you might regret it afterwards and feel like you've been railroaded into something that you actually didn't need to be. So don't let that happen.
I'd actually reiterate what Danielle said. You are the expert, really, when it comes to your body, and do not feel embarrassed. Do not feel you're doing something wrong by asking a question, asking for clarification, asking to understand, well, what does this actually mean and what will happen next? All of those things that seem like, we're talking about it now, it seems perfectly normal to ask. But when you're in these situations, you know, it can be tough. But you've got to understand that it's your body, it's your baby, it's your life. And I think also from a South Asian perspective, if I could bring that in here, I think a lot of us revere doctors, so there's a lot of respect attached to clinicians. I don't think that's a bad thing, but that doesn't mean you cannot ask a question. And I always say this to like my dad and that generation, that it's okay to disagree with the doctor. They won't mind. Have a conversation with them, understand the facts. And I think it's really important for clinicians to understand as well that if they're dealing with someone who perhaps doesn't speak English, just because they don't speak English doesn't mean that they don't want agency over their health. And I mean, you and I, Tara, have spoken in depth in the past about this, but South Asian media has lots and lots of information about diabetes that is all wrong. The reason it's there in the media is because diabetes is that one ailment that pretty much all South Asians at some point or another will hear of, will have family members that have. It's there, it's everywhere. So it's something that we talk about. We talk about it around the dinner table. We watch things on TV that talk about it. But the reality is that half of the information that you see out there is nonsense. And you need to speak to your clinicians, and you need to be able to do that, knowing that even if you don't speak English, that clinician will try to give you the best information and will try to actually communicate with you. I can't say enough. I mean, me knowing what my blood sugars were to the point of delivery was so incredibly important because nobody else did. And you've got to not feel embarrassed or scared of knowing your history, asking questions. And also, if something is said to you that you disagree with, say that you disagree with it. Don't just nod your head and agree because you feel you have to, because you don't.
And Sammy, how did you feel? Because obviously your diagnosis was quite, recent, and it was during pregnancy. So we kind of dropped this bomb on you. We looked after you as best we could during pregnancy. But, it's very hard to advocate for yourself. Some of these women have lived with diabetes for many years, and you're quite new coming to the story. How, if you had difficult conversations, or like you said, people didn't quite believe you when you said you were stopping all medications after delivery.
Yeah.
How did you kind of badge that? How did you feel and get around that?
Well, how I kind of got around that was just keep repeating myself over and over again. And they eventually listened. And but during pregnancy, I was very lucky, I think, listening to other women, because I had a team that did listen to me, that took my worries, fears, and everything into consideration. And yeah, I just felt very listened to, which seems to be quite rare. And yeah, I couldn't fault it, to be honest. With during pregnancy, it was just afterwards that I was having issues with feeling like they didn't quite believe what I was saying.
Yeah. And I think it's very interesting because, like, from my point of view, obviously, I've trained in a bit of general medicine, I've trained in obstetrics, and one of the big thing we kind of talk about is shared decision making, and especially in obstetrics, where there isn't one right way to deliver a baby, as you all know. Is what is the value that women place on various things? So, I'm really disappointed to hear, Danny, that we didn't really listen to you in terms of your fears about the way to deliver your daughter. And actually, different people have different things. And, the way another registrar Seema came to talk to you, to saying, actually, have you properly considered having or aiming for a vaginal delivery? There is no one way to skin a cat, no one way to deliver a baby. And I think you guys kind of touched upon this, but to really focus on it, to say having a conversation, because actually there are reasons why we may be recommending a certain course of treatment or recommendation for sliding scale, for example, and it may just be as simple as, well, the guideline says so, but then you can say, well, actually, from my experience, and my knowledge of what I've got used, that this is as good, if not better, than sliding scale, and etc. So actually badging it more as, this is still shared decision making. Yes, things may be going awry, or you might not understand actually something that I know, or you might know something that I don't know. So actually making it more of a decision, as opposed to people being kind of making it escalate into a difficult position or conversation, if that makes sense. And now someone has asked about diet, so a bit more into the nitty-gritty practicalities. How did you guys feel about your diet during pregnancy in relation to the diabetes? How much did you have to change it from your normal diet? How much did you feel, what was helpful for you, etc.? Danny, do you want to go first?
Yeah, I'll happily go first. So when I started for my 6 years in the pre-pregnancy planning clinic, my carb intake was outrageous. I was eating 120 carbs for each meal. So clinicians recommended I bring that down to 30 for breakfast, 40 for lunch, and 50 for dinner, which was a really big ask of me. And that's probably what took me most of the time, is reducing that carb intake over those 6 years. I didn't manage it fully. I very rarely got my dinner down to 50 carbs, but that was kind of the recommendations in the guidelines. And I was also given some tips on glycemic index, and how I can, if I was planning to go over that carb level, how I can eat other things with that meal to make the glycemic index different, so that I can manage that meal more effectively.
And I think one thing that we're all seeing as we're learning, just specifically about type 1 diabetes, is that actually the closed loop systems are very forgiving. So yes, it is easier to manage, a bolus for say 30, 40, 50 grams of carbs. It is easier, and it makes your life easier as a person with diabetes, but it isn't a strict rule that we have to adhere to. So there are other ways of managing that glycemic spike with your carbohydrate intake. And actually just a bit of trial and error, because lots of you guys have been keeping yourselves alive in between your appointments for many, many years, very successfully, I'm sure. And actually having a bit of trial and error between your appointments is no bad thing. And actually encouraging people to do a bit of trial and error about what works for them in terms of the amount of carbohydrate, depending on their activity, depending on their insulin absorption, and how the closed loop works for them is actually really important. And it's certainly something that I've taken in pregnancy, because that's the only time span I look after, but it certainly seems to work for us. And how about for you, Sammy? Because obviously being new to it, we obviously gave you a lot of dietary advice to begin with, and you did a lot of experimentation. You did amazingly well during pregnancy. I think we didn't have to increase your Levemir at all throughout pregnancy after we started. So how did you find, managing diet? What were the things that worked for you?
So before pregnancy, my diet was very carbohydrate heavy, very sugar heavy. I pretty much ate what I wanted, because I wasn't aware I had diabetes. I had no signs and symptoms at all. So my diet done a complete 180, and I ended up doing a low carb, low sugar diet, high protein, and that worked for me amazingly. My sugars got under control very, very quickly. I never had to take the Levemir. I never took it at all. So I was just on the slow release insulin. I can't remember what it was called now, and the metformin. And yeah, as I say, it worked very well for me. I ended up losing 7.5 stone in pregnancy, which is absolutely crazy. Unfortunately, some of that's come back on since pregnancy, because I've been left to my own devices and pretty much eaten what I wanted. Again, old habits die hard, I guess. But yeah, it really helped me with through pregnancy, and obviously I was doing it for the baby, so I had that to concentrate on.
Yeah.
But yeah.
And obviously this is just one example, so it's not like a rule or something, but there are lots of people in the maternity kind of side that are a bit worried about weight loss during pregnancy. Actually, in some people, weight loss is absolutely fine, and Sammy, your son is absolutely perfect, who is normal weighted, so there was no kind of ill effects of having that weight loss during pregnancy in your case, so it's not to be scared of these things. And I think, Seema, something for you, I think I'd like to ask you a little bit more specifically about in terms of diet, in our last few minutes. And actually, if any guys want to type how you found the diabetes clinic waiting times while we're chatting, is about different cultural foods. Now, this is a massive bugbear of mine, but no one listens to me because I'm a doctor. So how do you feel about, managing a diabetes diet? And especially some of us, we're very carb heavy in our cultural backgrounds. What would you kind of say about that?
So basically, what I would say is, so I met with the dietitian, spoke with the dietitian when it came to pregnancy and type 2 and generally for type 2 as well. And one of the issues I had was the fact that I felt that stereotypes that exist in terms of what we as South Asians must be eating all the time were very much at the forefront of the particular dietitians sort of talk to me. So, for example, she said to me, "Don't eat mangoes." And no, she said, "I guess you've been eating a lot of mangoes," which I hadn't. And then the whole thing around rice. So there are cultural nuances when it comes to diet that are very important. If you are Asian, regardless of whether you're East Asian, Southeast Asian, or South Asian, rice is a major part of our cuisine, our lives. So to sort of suddenly be told that you must eat brown rice, that just doesn't wash. And I'll be really honest with you, I think when I met with the dietitian, I met with the dietitian twice, and both times I was just like, I can't do this. I am going to have high blood glucose levels for the rest of my life because I am just not going to be able to do this. What you do is essentially, I think you find your feet. Telling me that I must eat brown rice and never eat white rice again is just not going to wash. And I did it my way, and I'm doing it my way, if you like. I have to. It's the only way I can sustain something that's going to work for me, to sort of have those rules, no more white rice or no mangoes or whatever it might be. And none of that washed, none of that worked for me. And I've had to do it my way. And if I don't do it my way, I will not be able to stick at anything. During my pregnancy, I literally stopped eating rice because I was really frightened that I would be doing something really negative to my child. So I just stopped eating rice. And honestly, it made me miserable for pretty much most of the pregnancy in terms of what I did eat, but it kept my glucose levels in check. And I would probably do things differently if I were to do it now. But at that time, I just didn't know how to do things the right way. And I felt that that was the right way. But now, as I say, I make things work around my diet. I don't want to see a dietitian. No disrespect to any dietitian out there, but I really don't want to see a dietitian because anything they have told me up until now just doesn't work for my life. And I'm pretty sure there's a lot of women from my community that are out there who feel the same.
Yeah, I was going to say like a few people, women I've seen. So I work now more towards the Peterborough side of the region. So we have a lot more diverse population, a lot more type 2 and GDM. And I am shocked all the time to hear women when they say, you know, I've just couldn't manage my diabetes the way I wanted to. And I've actually switched my breakfast from having what I normally have to having toast with avocado with eggs. And I was like, is that what you would normally eat from your background? And they were like, no, but that's what I was advised to do. And, you know, similarly, you know, members of my family have been diagnosed with diabetes, and, you know, rice is life in my culture. Like telling me to have brown rice is not the same. And there are other ways. And actually, you know, as well as social media being a bit of a nightmare, there are little pockets of social media where there are lots of East Asian, South Asian, Southeast Asian people talking about how we can change or adapt our diets and our usual eating habits to be less carb heavy or to have lower glycemic index. So it is worthwhile looking for. I have lots of examples because we've had to change the way we cook and eat in our household. And there are ways, but I do agree, Seema, like a lot of women find going to the dietitian, unfortunately, not as helpful as they would like, because there's not as much tailoring or diversity in the advice that they're giving. And that's no fault of anyone else's. If you read Carbon Cows, you know, we've had a whole separate Carbon Cows made for world food. So, and that's just, you know, us and then the rest of the world. So, you know, there's a lot more to be done in terms of dietary advice and things like that. Yeah, so I think that's everything from our side. I can't see any more Q's and A's to really address. Is there anything either of you or any of you would like to add now, or anything else you'd like to say? I'm just really overwhelmed with how much interest there's been. I think this has been a great session, and thank you guys so much from my side for sharing your stories, because I hear you guys talk to me in antenatal clinic, but it's not quite the same as sharing it with the broader community of staff. So yeah, anything else from you guys?
Definitely. I want to say thank you to everyone for attending. It's really great, like you say, to see the interest, and the interest in this topic specifically is going to change people's lives. So thank you for listening. Thank you for being interested. I've dropped my email in the comments box. If anyone wants to reach out with anything specific, feel free. I've offered the same to Dr. Tara before as well, and more than happy to answer or help in any way that I can. So feel free to reach out. Thank you.
Yeah, I just want to say thank you as well. And like Danielle, I've also dropped my email from a type 2 perspective. So if you have any questions, just give me a message. But yes, thank you very much for listening to us.
It's a thank you from me as well. These are really interesting conversations and really important conversations that I think need to be had. And I think from our perspective as well, to be able to tell clinicians our experiences is a really positive step forward in ensuring that we all sort of understand where we're coming from. So yeah, thank you to everyone who's attended.
Great. Well, I think that calls our session to a close. Thank you so much to everyone for coming. We're sharing some information about one of this group's amazing kind of talks. I can't go to this year, next year, so I'm gutted about it. But it is usually a really amazing day in terms of updating people on diabetes management in both type 1 and type 2, and exploring the kind of latest in terms of research and stuff like that. So, yeah. Thank you for everyone for your attention, and thanks for coming. And do keep in touch. I'll share my email address also in the chat. And I'd like to continue talking to you, Danielle, about making more of a community, because I think we don't put people with diabetes and mums with diabetes together enough. And I think that would actually help a lot, and also give you a bigger voice, so that when we're telling you to do something stupid, that you can tell us not to go do that.
Oh, well, a big thank you, Tara, and to our inspiring patients. It was really insightful and so thoughtful, and I hope everyone found it really useful. And I also want to thank all of you so much for taking part in today's webinar, and we would love to hear feedback from you. So please take the time to let us know what you thought, and especially for further webinars we can hold to help you. So any ideas or anything that you would like to see next, we'd really appreciate it. And after you leave this meeting, there will be a page full of questions, so it'd be really helpful if you could just fill that out for us. And a big thank you once again to Tara and your amazing patience. So thank you.